The title of the book is Being Sober. The book is really a guide for patients, their families, those who love them, those who employ them, those who care about them, for getting someone into treatment, into recovery, and through the processes necessary to achieve long-lasting sobriety. The most important thing to know about relapse is it's not absolutely necessary to stay sober, and that it doesn't mean that you failed if you do relapse. Relapse is an opportunity to strengthen one's recovery program, to recommit to one's recovery program. I've known many people who've done very, very well after a relapse, and so it's not a time to give up. It's a time to have hope and recommit. What would I like patients and families to know? I'd like them to know that there's hope. There's hope that this is a treatable disease. It's not curable. I'd like them to know that you have to commit to treatment one day at a time. I like to say that you don't get credit today for last week's insulin if you're a diabetic. You don't get credit much for last week's AA meeting or recovery attitude. It has to be renewed each and every single day. And that's what gives you the spiritual condition that fortifies your recovery and leads you on to another sober day. I think treatment needs to be about 60 to 90 days with the combinations of drugs, sometimes prescribed drugs, sometimes illicit drugs that people are using. They're detoxifying oftentimes for the first 30 days. So their brain's not really ready to receive and process the information that's necessary for beginning and maintaining their recovery. And so I think it should be that length of time. The challenges to treatment and recovery are getting over one's isolation, self-pride, anger, resentment, and denial, availing themselves of an intervention, of treatment, listening to those who love them, and then taking positive steps toward the actions that will hopefully bring them long-term recovery. What would I describe as the things that saved my life? Loving friends, repeated subtle but not so subtle interventions over the way. Absolutely getting stopped for a driving violation by a young man that had been my pediatric patient many years before. And then the ongoing support of the treatment program and the friends involved and sponsorship. Most importantly, a 12-step program.